Welcome to Catalyst for Healing. I am here with Justin Yannick, a doctor from Ketamine Clinic, and also with Elizabeth Cappelletti. We're so excited to have you on Catalyst for Healing. She is a licensed marriage and family therapist for over 20 years, and she and I actually have gotten to know each other quite well over the last few months, getting to work together because we both partner with Justin and his clinic and working with their clients. And so we're just so excited to have you on the podcast to share not only your personal experience with the medicine, but your work with clients. But before we do that, I just want you to go ahead and introduce yourself. Tell us a little bit more about you.
Well, you did such a good job there. Yeah, so I actually specialize in integrative and holistic medicine for mental health. And I have kind of just been on a quest of trying to find everything that I can to help the clients that I work with. So if you check out my website, it's like, I've got a training in this and this and this and this, because I'm just like a constant learner.
You
And
are.
it's funny, yeah, when I have gone to trainings, they're like, if you're doing anything else, like you're doing it wrong. This is the thing. And I'm like, ah, and I come and I bring it and it's like, okay, well, it's a thing I can use, but it's not everything,
Right.
right? So, and everybody's different. And I've come to learn that like my jam is anxiety, and there's like all these things that relate to anxiety. Like it's not just like, oh, I only have panic attacks. It's like, oh, I'm struggling with an eating disorder. Oh, I'm having depression, but it's tied to the anxiety or whatever other kind of stuff going on. And
We were laughing
actually, my
about that
journey.
because it's like
Oh,
I'm sending anxious ones to you and you send the depressed ones because we both just kind of have a
totally.
leaning towards one or the other, but they're always overlapping.
Yeah.
But it's true. Like there is a very specific way to work with anxiety that you're really skilled
Yeah.
at. So, anyway, go ahead.
Yeah. No, and I want to say, I can remember when I first started this work and they're like, you have to niche down, like pick something specific. And I'm like, but I like all these things. And I come to learn that, as I've journeyed through this, it all kind of still comes back to the stemming of the origin of all it being anxiety. And it took me a really long time to figure that out. And I've struggled in myself too with I actually struggled with an eating disorder and my own anxiety tied with that, which I feel like it's like anxiety, depression, OCD, and addiction all tied in one. Maybe I'll do a course one day on that. We'll see. But so in my journey, I remember during the pandemic seeing that oh my gosh, How to Change Your Mind, is that what it's called, on
Yeah.
Netflix? And it's like all about the psychedelics. And I was like, I have to do this. This is amazing. And I like, this is my personality. And I'm like, where do I sign up? And where do I learn how to do this? And, the program was, like $10,000 or something. So I'm like, I guess I should try this first and figure this out. And so I explored the psilocybin stuff first and then, had my own experiences with that and was a little bit like scared because at one point it was such a healing, beautiful, amazing experience for my first one and my second one. I'm very sensitive to substances, and so I got a little bit too much. So I was like, I'm never touching anything ever again, even though it was like such a, it was at a retreat. It was a very like therapeutic kind of situation. And then with some more time, I saw the ketamine clinic over here to the side next to my office, and I'm like, I should just go find out and like learn more. And I'm like, 45 minutes? You're in the journey for 45? No
Right.
way. And so I remember going in the first time. I'm like, they told me, okay, just have your person pick you up at this time, and I'm like, yeah, they're gonna have to pick me up like 4 hours later because I'm gonna be like out of my mind. No, I was ready to go and like walk out the door at probably an hour later. So I was really
That's a
fascinated by
really good
that. And
point. The
so,
contrast with like here you jumped into
yeah,
psilocybin and had this really intense experience, and I know we talked about how it
yeah,
was it was a very difficult one actually, and then
the second one, yeah, whew,
how going to ketamine, because I mean ketamine is a good starting point for a lot of people, and I think
yeah,
a lot of people want to
yeah,
jump right into some of the other psychedelics because they're being talked about so much right now, but it's an
yeah.
interesting contrast
And
that
I
you're
and I
sharing.
think and I think also just trying to be more natural as possible. And I think that's probably what led me to the psilocybin first. And I was really scared to do ketamine. I was like totally terrified because of everything that you hear. And when I went in and you guys explained it, and then even later when I did the training, I was like, oh, wait a second. Like, this is like, wait, I can do
Yeah.
this. And so being in a situation though where, because the first journey I did with mushrooms, with psilocybin, there was four people that were part of the journey, and there was like two people leading it. And then the second one, there was 14 people who were
Oh,
in the medicine.
that's a lot.
So it was like a very, yeah, it was very, um, I probably wouldn't recommend that, sorry, but I wouldn't, like coming from a therapist standpoint too.
Yeah.
Um, Also because like
And
I've done
setting.
so much work on myself. Yeah, set and setting. I've done so much work on myself, but there was still stuff there that I didn't even know was
Yeah.
there, which I ended up, that was a really big component of the work with the ketamine that I did. I came in like bawling as they're asking questions, like, how are we supposed to work together? Like, so, but, so just thinking about some of the clients that I've had that have some really intense stuff, like sending them to, if there was like a setting of 14 people doing mushrooms and there wasn't, so that's the difference I feel like with the ketamine and especially when I went to your clinic, Justin, having a nurse and I think it was is Jim a PA? Is it? Yeah, a PA. Like I just felt so safe and secure and like if I needed anything, they're gonna hold my hand. They're right by my side the whole time. And then even doing the journeys I've done in my office, it's like I'm right there, right? So it's just such a different experience. And then knowing like in 45 minutes it's you're good, right? So for me with the mushrooms it was like, and I'm not anti-mushrooms at all, but it was like 12 hours and I'm still like ah! So that part is, there's kind of some fun to that, but yeah, so I think in my journey of trying to find healing for myself and for the people that I love and the people that I care about, my clients who are people that I care very deeply about too, I'm just always trying to find something new, have a new tool and see when and where that works. So that's kind of how I've come to be such so integrative and holistic and
Yeah.
yeah.
So I recently, I mean, we're so lucky that we get to work with so many amazing therapists, such as you two. But I think it can be challenging sometimes to for patients to identify the right therapist, and for me to identify who might I refer this patient to. And so I've started to ask patients, kind of on consultations, like the question of like, what makes you you? Which is kind of an open-ended question, and you could take it wherever you want. But I'm curious, given where you are in your career now, how would you answer that question? Like, what makes you you?
Well, what makes me me? I've been through a lot of shit in my life, so I'm sure that that influences me.
Mm-hmm.
I think it's kind of hard. My brain kind of flip-flops in a lot of different ways, because I could have ended up a lot differently because of my experiences as well. So what makes me me, I think, is my heart. So at the core, I have like a really big heart and for love and compassion and caring. I'm extremely empathetic. I used to cry at night when I was a kid and pray to God to take it away from me. And it makes me tear up thinking about it because it's my greatest gift. But it's a painful one sometimes, so I can't even watch the news. That's why, when you talked about it, I'm like, oh yeah, this is I always hear about stuff. But I'm very empathetic and compassionate. And I think that's also been part of my journey and the struggles that I've faced because I feel so much. And so I'm not the type of person who just like lashes out at people. It was always like just it would turn inward. And so that was the journey that I had to overcome. And I'm very tenacious. I realized I have ADHD and I didn't realize that till I was like 40, even being a clinician. I was like, oh, wait a second. But I think that's also the beautiful part of it is like, that's why I have 18 million trainings is because I get super excited about different things. And, I'm an artist. I'm actually just, I don't know where it went. I just have books that I make and create. I just printed this one up.
Oh man, that's so cool.
So yeah, like I just am always doing lots of different things. And I think that is a cool thing about me. But at the core is my compassion and my heart. And if I don't know how to help you now, I will find a way to do it. And even if that means taking a course and having to, get certified in something else or referring out and connecting. So try to be a humble person. I feel like I am. I'm really good at, I don't know, one of the things I found that I'm working on, and even through my ketamine journeys, I'm really good at like advertising other people and their businesses. And so I've now started on my social media to like, oh, by the way, you can come work with me. So, that's like a thing, right?
Yeah.
So, And I'm just very growth oriented. I feel like until the day that I die, I will be growing and learning and trying to be the best version that I can be. I'm a perfectionist in recovery. So, there's that. But so I don't know. I don't know if that answered the
Yeah.
I mean,
question.
it answers it, but I think to add to that, and that's one thing I resonated with you around is, as therapists, we're trained not to share about our personal experiences, but it actually is what makes us who we are. And it is
Yeah,
what
yeah,
makes us good at what we do because we all end up specializing in stuff we know very intimately. And I know you are open to sharing that. And so I'm wondering if you're
yeah,
open, to going into that a little bit more detail because you've had the unique experience of doing a ketamine journey at the clinic with the IV. And then you and I know
yeah.
you've done other ones besides this, but you and I did one in your
Mm-hmm.
office with sublingual, and that was really
Yeah.
a beautiful experience to do with you. So, would you
Thank you.
mind? Because I do think that's really what shines in your work with your clients because you resonate with
Yeah.
where they're at, and you've gone through your own healing journey with some of those same things.
Yeah, and I definitely like because there's different modalities of therapy, right? And so for me, when it's appropriate, I do share some of the stuff that I've been through, and I feel like it really disarms my clients and helps them to connect. And before having my third kiddo, I did a lot of work with teens and kids, and like especially with teens, but not even just them, like somebody else coming in and just saying like, "I see you," like this is something I've walked through, and not that to make the session about me, it's not about that, it's just only when it can, like, somebody can find hope and also see like, oh wow, you get me, you understand, like you understand what that's like to walk through that. So for me, actually, the second journey of psilocybin, when I like, it was really gnarly. The lady said to me, she shared this story with me about something she had walked through, and I guess when she had done a psilocybin journey, some stuff came out about some like sexual trauma that had happened to her that she hadn't remembered. And then she says to me, I think that there might be some stuff that you haven't worked through yet. And I'm like, okay, like I feel like I've worked on a lot, but maybe, like, I don't know. And plus I'm not touching anything ever again. And so
Right.
as I kind of, she actually recommended ketamine for me. And so when I came to that point, like there was some stuff that started opening up for me. And I think it had to do with, I have three girls. And as my oldest is like getting to look at this age of where I remember some things happening, it was bringing up a lot of stuff for me. Like, and then all of a sudden, because this is how God, the divine universe works, like client after client, new client, all this stuff started coming in, all about like the sexual abuse, sexual trauma, all roughly around the ages that I was like
Wow.
uncovering things. And so when I went in and I met with Jim, he's like, well, what are we working on? I'm like, well, I wanted to do this, but like, and then I just start bawling. I'm like, all this stuff, and I don't know, you know, because I was really challenged with if these things happened to me, like some of which I knew, but I didn't really label it as sexual abuse because I was 14, so I thought, well, I went along with it, so it was okay. But I look at my daughter and I'm like, oh my gosh, if somebody, gonna make me tear up, but if somebody had done these things to her, or if a client came to me, I would have to report that, because this person was so much
Right.
older. And then just uncovering other things without going into too much detail and traumatizing anybody with my story right now. But just there was other things that were starting to kind of come to light from when I was younger. And so I go in, and I think what I was struggling with too is like, I don't want to be a victim. Like, I don't like, what does this mean about me? Like, that these things happen to me. Like, and I was really struggling with that. Not that it's almost like it's okay for other people, but somehow not me. Like, I don't know. I was just struggling with this. And so when I went into the medicine, there was this meditation that was being played, and it was about my worth and my value and being enough. And that was like, so powerful to me. And it's something that over the last few months and years I've been working on, but I really feel like in the last 6 7 months I've really kind of gotten a stronger foundation in my worth and my value. But a lot of that ties into the abuse that I experienced
Yeah.
too. And so when I first went into the medicine and it started, like, I didn't really know exactly what to expect, right? And so I just had this visualization of these like mountains and these stalagmites and this water running through. And it was like I had this sense that I was this water, and what came up for me, and I could barely talk because I'm very sensitive to the medication. Some people are like, oh, they can talk or whatever. I could barely mutter any words out, but the words that came out were they could never touch who I am.
Mm.
And that was so powerful to me because, being shaken about what does this mean about me or who I am or any of those things, it's like they could never touch who I am. I'm a spiritual being having a human experience. And I rewound to 12, 13 years earlier. I took this certification course, certifications for hypnotherapy, and it was like from rapid resolution trauma, and they work a lot with sexual abuse victims. And I remember him doing this exercise that I couldn't really understand and connect with it. And he was saying like, okay, you have an elbow, you're not an elbow. You have an arm, you're not an arm. You have a knee, you're not a knee. You have a vagina, you are not a vagina. Don't call me a vagina, I'm not a vagina. And it clicked in that moment. Like 12 years, 13 years later, I was like, oh my gosh, like that's not who I am. Like these things that may have happened to me or what, and like that's not who I am. And so it was this profound moment for me, like profound, because there's been multiple experiences of things that have gone on in my life, and like that's not who I am. And so starting to kind of see that just kind of unlocked this journey for me, and I had all of these other amazing visual things, and it was different than psilocybin. It was like, yes, visual, but like kind of more almost like, I guess my description would be like if I were to close my eyes or with my eyes open, try to imagine like a tree, and I could see it, but it's not as like I'm still connected and tethered to this here, right? And so I felt like that was different for me, which I think could be a really I don't know the word soothing or reassuring thing for some people to hear that, because I think with the mushrooms I was not tethered here. I was like,
Yeah.
this is not a reality. I'm not, So, and again, not trying to be anti psilocybin. Like I had tremendous healing from that as well, but
That's
smaller
an
doses.
incredible shift. I just want to
And the
emphasize what
setting.
you're just saying. It's like to go from feeling like the victim to going,
Yeah.
that is not who I am. Like just that
Yeah.
shift alone is so profound for anyone who's experienced
Yeah.
abuse, right?
Yeah. Yeah.
Mm.
And
Yeah,
go ahead, Justin.
I'm curious, like, what your thoughts are on, like, how psychedelics can affect one's identity and perception of their identity. And you can take that however you will, but we've had so many patients come in who have this narrative about themselves that I don't think maybe even intentionally they're trying to change. They just want to feel better. But over the course of their treatments and working with y'all, like it's so obvious that they just start to like love themselves more. Um, I
I
don't know.
have
What
chills
are your
when you
thoughts on
said
that?
that. 100%. 100%. Like, and I've seen that in clients and I've experienced that firsthand, right? So I forgot to mention that before I came in that day to your clinic, Justin, I had been having like flashbacks and my brain was just
Mm-hmm.
like, I mean, I would find myself driving, still paying attention, but like, that thing where you're kind of like stuck and you're just in an image, and it was just everywhere in my body and in my, like, it was
Yeah.
no bueno. And then there was a part of my brain that was trying to figure out stuff, right? Like what happened? I'm filling in these puzzle pieces, and my brain wants to know. And it was like, I mean, it's going to make me tear up as I think about this, because even this, okay, like stuff has opened up so much for me. I feel like my creativity has been like unleashed because I don't fucking care what anybody else thinks. Like,
Mm-hmm.
I'm fucking awesome, and not in an egotistical way, but like I'm a creature and I'm a creation of God, and because of that I am beautiful and I'm amazing and I'm lovable and I'm enough. I am enough, and that is what I feel like
Mm-hmm.
the ketamine has like really helped me with. And Mia was there with me in my second journey, and she saw like I think amazing stuff happen within me too, and realizations about things. So 100% yes. Like I don't know, it's like I feel like you get to grasp and like touch like what all of this is, this life, and just yeah, like my narrative and story was always about trying to please everybody else and trying to be good enough and trying to be pretty enough and trying to be perfect enough, and fuck that. Sorry if the F word's not allowed, you can bleep that
I'm like,
out, but
yes.
yeah, like that's not how I'm gonna live my life.
Mm-hmm.
And yeah, so profoundly has changed that for me. And I'm still working on it, right? And sometimes it's like, oh gosh, I think I need to go do another session to kind of work on that, like to get
Mm-hmm.
reminded of it. But I think there's a lot of us walking around that, even from the outside, people might not realize what we're struggling with and what we're carrying. We might seem one way to the rest of the world, but we're carrying this stuff maybe of worthiness or past trauma. And I think just tying to that, like what that means about me, if the people in my life, if my family, if these people who, because I had these foundational roots with my family, then I chose these relationships, right? And they're constantly making me feel not enough, not good enough, that I'm this and that, then it must be true, right? But no, that's about their brokenness and their stories of stuff. So,
Thank you. You articulated that
yeah.
really
Mm,
well. I just holding space
yeah.
for, I remember how beautiful that was to be with you in that, experience, and how much you were taking in the love, the self-love. And that,
Yeah. Oh gosh, I forgot that when I first started, when I first felt the medicine with at the clinic at the IV, I remember just like this love that I can't even explain. Like I have, for those of you who have kids, and Justin, you will soon, right? Like the love that I felt for my child when she was born, like it's something that I had never experienced. But I, in that moment, in that journey, felt love towards
yeah,
me,
Mm,
like the most
mm.
immense love that I'd never ever felt before. It was beautiful.
yeah.
I had forgotten about
No, I
that.
love how you
Can't believe I forgot
articulate
about
that,
that.
because I mean it's true. Like that feeling of love that you experience with the medicine, I can resonate with that. And it felt that way with me too, of just like how much I
Yeah.
love my kids. I had never felt that way towards myself
Yeah.
until I
Yeah.
had had a journey and had that such a profound shift coming out of that, right? When you can
Yes.
love yourself at that deep level, it changes everything. And it changes how you love other people.
Yeah. True.
I'm curious when, first of all, like the way you articulate that is so beautiful, and I thank you so much for sharing
Yeah.
that.
Yeah.
I'm curious when you guys go through your therapy training, like, is the goal like to love yourself? Like, what is like when you think about like where I'm trying to take a patient, or where you're taught where I'm trying to take a patient, is it to for them to understand themselves? Is it for them to love themselves? Is there like a this is the benchmark and this is what we're shooting for, or is it depend on the individual? Like, how are you taught that?
Yeah. I mean, it's a really good question. I think the fact of the matter is that I always tell people, like, when you go to school, you're taught this foundation. You're not really taught how to do therapy. And that's why I do all these like trainings and stuff afterwards, because you're taught about all these different dynamics of what causes the problems in the first place. It's a lot of like problem based, right? Like the problem comes from here. The diagnosis is this, and you're like, my mom has this, and my dad has this, and I think I have 12 of those diagnoses. Like this whole thing. And I mean, if I were to say that, I would say like working through the family therapy dynamics is like trying to have peace among the family members, so they, so maybe trying to have help people to find joy and peace and purpose. Now, were those words ever said or spoken? I don't think, but I mean, I would think at the core for most of us who go to these
Yeah.
programs, well, number one, most of us have our own trauma that we've been through that leads us there, but most of us have like a really beautiful heart of just wanting to help heal the world, right? Help people heal, help people have good relationships, help people, and success can mean a lot of different things to a lot of different people, right? It's not just about money. It's not just about health. It's not just about relationships. It's not just spiritually, but it's all of those things. So I think it probably depends on the person, right? Because I think for some people, it's like, oh, well, if I'm functioning and I look well and I'm working 80 hours a week and I'm doing this and I have a fancy car, then I am good, right? But like, okay, but that's a part of it. So I don't know if I answered the question, but
No, you did well. I think I would add to that. That's just the beauty of this space, is I feel like we're taking even psychotherapy in a new direction. It's like we're not
yeah.
just wanting to heal, the self and the loving yourself, but we want to see that self express itself in the world, and we want to see the
Yeah.
purpose, and the community that comes from that, and that healing, just healing yourself, is going to have such a ripple effect. And that's the
Yeah.
part that's so exciting that we don't talk about. It's like therapy can be very selfish in a lot of ways, but the actual goal would be people are actually living out of their true selves in a way that's so authentic
Yeah.
that they're impacting people around them, and they're having they're living out their purpose, really.
Yeah, absolutely.
It's interesting that ketamine and other psychedelics oftentimes are discussed in like promoting this idea of like collective consciousness or feeling
Yeah.
connected to all those around us and like out of your head, which for many people with mental health problems is they can't get out of their head, right? They're just stuck in these
True.
fixed thought spirals. But it's interesting that the manifestation of getting out of your head is like loving yourself. And
Hmm.
I'm curious where you think that comes from. Like what is it about getting out of those thought spirals, feeling connected to those around us that sometimes is the only way to really look back and learn to like love yourself for who you are. Does that resonate with you at all or
Yeah.
No, I mean,
I was
go
thinking
ahead,
from a
Mia.
trauma perspective, again, all of those parts of us that developed in childhood to protect ourselves kept us
mm.
from loving ourselves. But, well,
Mhm.
actually, I lost my train of thought. What was the question again?
It's I to be clear now for all the listeners, we don't prepare ahead of time with these specific questions, but it's like this is something that I think about a lot because
Yeah.
I think so often we have people that come out of the experience and talk about how like they feel just this like love and connection to those around them.
Yeah.
It's not necessarily always expressed as like I love myself, but
Yeah.
we see that it manifests over time as they start to like love parts of themselves and then learn to love more and more of themselves. And it's interesting because it doesn't seem directly connected,
That
but
was the
it
thought I had.
obviously
It's
is.
the shame,
Yeah.
right? It's the shame cycles and all those ways that we're stuck actually being focused on the negatives about ourselves that keep us from being alive and being human and having an
Mm-hmm.
impact on the world. So really
Mhm.
the love is the antidote to that. And that's what
Mm-hmm.
I think a lot of people are coming in with, that suffering of criticism and self-shame and all these parts that have protected themselves by doing that, but it's detrimental to their mental health.
Mm-hmm.
And I was gonna say too, like, you took that word connection because I was like, it was pinging in my brain as you were talking about that. And, for me too, even part of this, like when we talk about that connection and other people's, like being connected to everybody and stuff, the word ancestral wounds kind of came up for me. And so like there was a time, I think I was with you, Mia, when I saw these like those Russian stacking
Yeah.
dolls, and it was like I saw all this trauma inside, like, and I was like, oh my gosh, there's no way my mom could have given me more because of what she came from, like, and I was like, oh God, my mom probably won't hear this, so that's good. But like, my realizing my mom really isn't like super affectionate, and I was like, I'm realizing this at 44 years old, and I think I said to you, I'm gonna go home and tell my husband this, and he's gonna be like, yeah, like you didn't know that? No, I didn't know that. But then I look at what she went through
Yeah.
and how this ties to all of the healing and connection is like people are just carrying their wounds, and they're like they've got these protective parts that, if it's that person who always has to be right about everything and is controlling and is like kind of puts people down, like that's their wounds coming out, that's all their hurt that they have. And can I connect with, and I know this is hard when people have faced atrocious things, like atrocious things. But then you have people who face atrocious things and have somehow found forgiveness. It isn't even about the other person, it's about them, because I don't need to carry this. And I understand how broken that person is, like how utterly destroyed that person is and what they're carrying and like what's happening, right? And so like there's a little baby piece of compassion, and I think that healing can come from this place of like, that's not about me.
Right.
What happens to me and how that person is treating me is not about me. Now I get to decide if I want to spend much time with that person.
Yeah.
Don't recommend spending time with people who are hurting you,
Elizabeth,
okay?
what did that
But it's not
shift,
about
sorry to
me.
cut you off, what did that shift do for you when you were able to see, the Russian stacking dolls and seeing, okay, your mom wasn't affectionate? Like, what did that shift for you in that awareness?
I think it like added some puzzle pieces to the board for me. It also like I don't want to keep trying, I have a client who always says like I don't want to go to the hardware store expecting to buy milk.
I love that.
So I think what has happened in my life again and again is I keep going to these sources of trying to get love and trying to get acceptance. But how can they give me that when they don't even have that for themselves? And so they see the world in this way, and it has nothing to do with me. And so when I can connect to and find, like source, or find people who actually show me the love that I deserve and want and need. Like, it's just different. And I found myself being like, okay, I'm going to do this. Oh, I don't, because before I'd be like, well, what do you think about this? Like, I don't need to see what anybody else thinks about it. Like, and that might sound arrogant, but before it was in such a place of like, I'm not enough and I need you to validate me. And so why would I go to a source that can't give me that?
But also it gave you, because when I was with you too, it was like a combination, the contrast of that and compassion for her. It's like with this
Yes,
thing
that's
going
true.
through. And I
Yes.
think that's a
Yeah.
really missing piece for clients, because I know we're in an era where people are doing a lot of cutting off, which sometimes that's appropriate.
Yeah.
But
Yeah.
to the extent, I just love the contrast of that. It's like
Yeah.
recognizing, okay, what can I get in this relationship and kind of keeping it there, but also having compassion that parents
Yeah.
are humans and we're all limited.
Yeah.
And I just think that was a beautiful thing to experience with you, because our
Yeah.
clients all go through that. Like, how do I
Hmm.
navigate that contrast of having those angry feelings that I didn't get what I needed, but then also knowing like they didn't have the skills, you know? And
Yeah.
they
Yeah.
overcame a lot of what they went through as well. So anyway, I just loved that piece.
No, I mean, I think it's so true because it helps with the anger,
Yes.
right? Which helps with the healing,
Yes.
which helps with forgiveness, which isn't, again, about, and I know that there's a lot of people who are doing this cutoff, right? But in the process, if you're cutting off, I hope that you're still working on your stuff and working on forgiveness, because it's not about them, it's about you and like your healing journey with that. And I think that having compassion and understanding from where somebody came from and like what they walked through, because they might not have shared this with you. And by the way, repressed memories is a real thing. Let me tell
Yeah.
you. Like, and I remember being in school being like, wow, what would that be like? Like I feel like that could be possible, but like where things happen, I mean, it's quite amazing how our brain does this thing to protect ourselves where we just don't remember horrible things that happen sometimes. Like completely,
Yeah.
it's like it never happened.
Yeah.
Right. And so the same thing can happen for our family members, maybe that they've been through, that maybe
Yeah.
that they don't remember or that they're not sure as hell not going to share with you.
Right.
Right. Because I mean, those of us sitting here, we've come from generations before us that, and they're still going to continue to be that to some extent too, but like where people just don't talk about stuff. You don't talk about things. You don't, and the more we grow up with that, the more that's going to continue on. But
Yeah. Yeah. Can you share a little? We have a little bit more time, but we want to wrap up pretty soon. So, can you share a little bit about any experiences you're noticing with clients in terms of what shifts are happening when you're bringing in the ketamine? Because I know you do some works with sublingual, and you're working with the clinic.
yeah, one of the biggest ones that was really, really cool was I had this client come to me and she had been like partying a lot, for lack of a better word to say it. She's like, I can't seem to stop. Like, I just go and I drink and I get hammered and I'm like, just, I don't know, I keep doing this. And we're, before leading up to the session, we're kind of working through kind of what's gone on. And she had one session. So her intention was to like basically, I mean, we put it in a more positive spin on it, but like to not be going and doing that. And she'd tried everything before. Well, not everything, but she tried a lot. And so she did this one journey and she was like, it was like everything was illuminated to her as to like why she was doing some of this stuff. And then she told me, like, and this was for months after, she's like, I don't have any desire to drink. Like, and if I do, I have like one beer. That's it. And this girl's like in her early
Yeah,
20s,
that's a big shift.
so that was like a huge shift because she started to realize, and there was also a piece in it where it was like she was validated, like her suffering and what she was going through and what she was walking through and some of the choices that she made was like validated when she was living in an environment where nobody was validating her experience.
Right.
So suppressed emotions and feeling invalidated, we do a lot to numb out from that, right? And so I think she was she recognized that and it was like, and she was like, I feel so good afterwards. Like, she's like, I feel like this is like an antidepressant. She said she went out, she felt like the sun was brighter and she like sat outside, which she wouldn't normally do. And this like continued.
That's
This wasn't just like a momentary thing. So
that's
that was really, really cool.
yeah.
Yeah, I think it's interesting because I think as you started that, I think there would be some people that would react to be like, "Oh my gosh, you gave ketamine to someone that was like a party person, and like weren't you concerned about abuse or addiction or things like that?" And
Yeah.
it's like the most common question I get when I'm talking to patients or their loved ones, and I think we've gone over this before in other podcasts, but I think it just obviously yes, it depends. You have to to
Yeah.
have good communication with the patient. You have to discuss with them how it's going to be used specifically in a controlled environment. But I think that the literature supports it, and experientially, as you're describing it, it supports it, that for the vast majority of people that are doing this, it like opens them up, so that the reasons that they were abusing drugs in the first place, they recognize how that's not actually benefiting them. And
Yeah.
we've worked with, for us, probably the most is with alcohol and marijuana.
Yeah.
Yeah.
And marijuana is a really interesting one because I think a lot of people that use it regularly don't think of it as harmful to them. And what we're seeing more and more is that for a lot of people, it's really a depressant. And as they kind of come off it through the ketamine experience, whether one or the other is leading to them kind of feeling more open and whole, it's hard to say, but it's quite clear that like it can get people off of these kind of drugs of abuse.
Yeah.
So
Yeah.
just an interesting point I've seen quite often.
Yeah, and I would say like it's such, she wasn't like she was partying using ketamine or anything before,
Hmm.
but I
Yeah.
think the difference is too, I mean, even with drinking and with doing some of these other substances, or people have used some other substances in the past, there wasn't this like, for the most part, this like internal voyage, right? It was like, let's go out and let's go party, let's numb out. And this is such an internal, like, you're laying there, you're in this journey inside, you're noticing all these things and the symbolic stuff. And I understand the importance of a therapist being trained in this too, because otherwise they come in like, I was this tree and then I was the earth. And they're like, what are you talking about? Right. What does that mean for you? And the symbolism, right? Actually, I totally forgot to mention to you that this thing kept coming up for me in each of my journeys, and it was me being pregnant and having a son. And I like kept walking away from it thinking like, oh, it's like a premonition, I'm gonna have that. And the other day I was like, what if it wasn't? What if it was a symbol just like everything else? And I asked Chat GPT, because I don't know, it's pretty amazing the stuff that comes out of that thing. But everything that this Chat GPT said was like so spot on with like my healing and growth and creativity coming out, which happened because of my journeys, y'all. Like seriously, I mean, it's incredible. But what I think, speaking back to, we're not doing this, is it's a totally different setting, it's a totally different intention. We're processing the stuff, going in with an intention, processing it afterwards. And
Yeah.
I mean, it's life changing. It is seriously life changing. And I'm so grateful I met you guys.
Oh, well, it's just so wonderful to have you.
Good.
And thank you so much for sharing not only your personal experience, but your work with clients. And I mean, Justin
Yeah.
and I adore working with you. And hopefully we can have
Yeah.
you
Oh,
back.
You're amazing.
You know,
I
Yeah.
absolutely,
I
I
feel
love
like
that you're doing this.
we have more questions for you, so we'll have to get you
we'll
back
have
in
to get you
sometime in the
back. That was
future.
amazing.
Yeah, I'd be honored. I'd be honored. Thank you so much. Well, keep on doing the amazing work you're doing. And I know we'll keep collaborating and working together to help
Yeah.
people on their healing journeys too.
Thank you.
So
All
thank
right. Well,
you.
we'll look forward
Great.
to seeing you guys next week. And thank you for watching at Catalyst for Healing. Bye.